Hello, everyone. This is Marcy Gallagher with Mountain Pacific Quality Health, and welcome to today's session of It's Worth a Shot. Today, we have a couple presenters from our office. Kyla Newland will be giving an update on the new Bivalent COVID-19 vaccine, and Miranda Brzezinski will be giving some tips on managing during the pandemic. Next slide, Mary. So as always, these meetings, we want to be value added. So if you have any topics, we would love to hear from you. And we will continue to meet every Wednesday. So feel free to enter your suggestions in chat. Next slide. And as always, a very special thank you to all our guest speakers, our partners, and you all who are attending each week. And you continue to support the needs of your residents and long-term care facilities across our regions. Thank you. Next slide. Before Kyla gets started, we are going to do a quick polling question. What is your preferred method of receiving information? We're always looking for ways that we can reach folks and some new innovative approaches. I know I've been trying to listen to more podcasts these days. So what do you all prefer? All right, I think we could probably end the poll, Mary, but it looks like the leading means of receiving information is through email, attachments, and newsletters, along with webcasts coming in next and short pre-recorded videos, small number of used selected podcasts, or a panel discussion. So thank you. All right, so at this time, I'm going to turn it over to Kyla, who's going to talk to us about the Bivalent COVID-19 vaccine. Take it away, Kyla.
Thanks, Marcy. I'm going to apologize in advance today, everybody. I've got a little bit of a cold, so I've got my throat coat tea here, and I might be a little nasally. Today, I'm going to share with you some information that I'm sure you've all seen in the news about the Bivalent COVID vaccine being available for our booster vaccines. Next slide, please, Mary. Before I talk about that, I just wanted to make everyone aware also, something I presented on previously was the availability of the Novavax vaccine, which, as you recall, was a new protein subunit vaccine that's administered in a 2-dose series similar to our mRNA vaccines. And what they did on August 22nd is they extended the age approval down to age 12. Previously, it was just 18 and older. So just a note on that for folks that might be wanting to get that vaccine. Next slide, please. So this is what came out on Thursday after the ACIP and CDC had their clinical recommendations after the FDA approval of the Bivalent COVID vaccine, which basically includes 50% of the Wuhan strain and 50% of the Omicron BA4 and BA5 components to expand coverage for these new variants that we're seeing. And so it should be available. I know in the state of Alaska, they said it was going to be coming into our state this week. And so I'm assuming that's happening in all your states. And as you will see on the next slide, the old booster vaccines are no longer recommended because we know that this new vaccine has better coverage for the new variants. We can go to the next slide, Mary. So this is just kind of the information from CDC. This came right off their webpage, stating that there are still recommendations for all the other folks to get their primary series, the younger population, that we should continue to get these vaccines to increase coverage and provide more protection. There might be additional recommendations for additional doses for moderately or severely immunocompromised. And then the 2 bivalent vaccines, the one from Pfizer is approved in 12 and older, and the one from Moderna is approved in 18 and older. And please feel free, if you have questions as I speak, to interrupt me or put your questions in the chat. We can go to the next slide, please, Mary. So this is just a few things that are really what do we need to know. So as I mentioned, our monovalent old booster vaccines are no longer authorized for use. Basically, the emergency use authorization of the new formula overrides the old authorizations that were in place. And as I mentioned, it does cover the original strain plus the BA4 and BA5, which we're seeing primarily circulating in our areas now. And I see a question. Does it mean that residents and staff need to have an Omicron booster to be considered up to date? I don't think we know that yet. I will probably defer to some of the nursing home team folks, but I don't believe that there's any recommendations that we've seen yet on that. Marcy, did you have any additional information?
I don't, Kyla, that's a good question, but I'm thinking if they previously received a vaccine or the booster, it's not like they'd have to receive this additional booster to be up to date. I think if they are up to date with anything that they had received in the past, they are still considered up to date if they're not, unless anybody else knows, but I'm assuming that that's the case.
Yeah, I would make that same assumption. And if you look at the up to date, it still states what you said, Marcy. But things are changing rapidly, so all of this information is easily changeable or updated as we go on every day, pretty much. So things are in flux as we kind of roll this out. So the time frame for the patients to be
Sorry, can I interrupt for a second?
Yeah, go ahead.
This is Anna Leewald. I'm sitting with Katie Martin from South Peninsula Hospital in Homer, Alaska. Yesterday on a State of Alaska vaccine provider call, they did say that the up-to-date definition had changed and that in order to be considered up-to-date, you would need the bivalent booster because it is Omicron specific. And even the CDC's webpage that says, are you up to date? The wording is difficult, but you'd have to get the bivalent booster in order to be considered up to date.
Yeah, thank you so much for that. And I'm wondering if the question is more related to the CMS requirements, but I'm not sure. But you're correct. The up to date on the CDC website does say, since that old booster is essentially outdated, that you should get it at the appropriate time frame, which is at least 2 months since you completed either your primary vaccination series with any of the available products on the market, or since your last booster. And as I stated previously, the Pfizer is for 12 and older and Moderna for 18 and older. And I see someone noted, yes, CMS usually follows CDC recommendations. So maybe anticipate the CMS requirements coming down the line potentially. Okay, we can go to the next slide. So one of the questions that came up was, how are we going to prevent errors when we're looking at the new formula versus the old formula? And these vials do look very similar, as you can see. Our old booster dose for 18 and older had the blue cap. The new one does as well. The only difference that you're going to see there is that the booster doses only is highlighted in gray, and the border there is gray. And on the previous version, it was purple. So it's a minor difference, but definitely something that we're going to have to make sure everybody's educated about as we're rolling this out. And I see another question. Do skilled nursing facilities need to offer an additional vaccine clinic in the next 60 days since the most recent CDC recommendation? That is a very good question, and probably something that we can put on our agenda for next week as a Q&A, unless anybody knows the answer.
This is Dana. I think, again, since we don't have a mandate or guidance or whatever from CMS about them changing their up to date, that I would only if you have folks that you still haven't gotten up to date that need to be up to date in the next 60 days, then I would get them up to date with this new vaccine. But if you don't, I think I would just hold off until we know what CMS says, unless anybody has a conflicting opinion on that.
Oh, thank you so much, Dana. Okay, we can go to the next slide, which shows basically the subtle differences in the Pfizer booster vaccine as well. Basically, it looks identical, except it says bivalent on the label. So definitely going to need to make sure that we're checking our stock and getting rid of the old, moving in the new, and making sure that we're not having any errors because of the similarities between these vials. Next slide, please. So just a few frequently asked questions that I put together. Folks are wondering, can I do the bivalent booster with my flu shot? The answer is yes. Can you do it with other vaccines? The answer is yes. The recommendations from the CDC are that you put the vaccine in separate injection sites, preferably the separate arms if that's feasible, unless someone has a contraindication to having a vaccine in one of their arms. That is so that we know if someone has an injection site reaction or some kind of reaction, which vaccine could be the likely culprit. Also, can facilities offer it during a flu clinic? Absolutely. I think that's going to be one of the strategies moving forward is getting people their vaccines on the same day and making sure that they're up to date with the recommendations. And another question, is the new bivalent vaccine going to be potentially indicated for our primary series? And we don't know that yet. There is no information about that yet, but I would say potentially if we have a vaccine that covers more current strains, it would make sense that we would be eventually switching to that for our primary vaccine as well. And if anybody has, as I stated before, if anybody has more information about that, feel free. As we know, information is coming out quickly and changing quickly. Next slide, please. So is there a combo flu COVID vaccine? There was a lot of rumors that was going to be coming out this fall, but that is not going to be probably until next year. For next flu season, there are a couple different companies that are looking at formulas for a combo vaccine. How effective is the new bivalent booster compared to previous boosters? Well, the data that we have currently on the bivalent vaccine that was approved does not actually have any human studies yet. Preliminary data does show good titer responses in the animal trials. So we are just waiting for the human studies, but the FDA and the CDC felt like this was something they needed to push through in order to get these newer strains covered. And so they did approve it with the ongoing clinical efficacy in humans for death and severe disease still in process. And then can you mix and match? And the answer is yes. No matter what you got for your primary series, you can get this booster. And I think that might be my last slide, Barry. There might be one more. And I'm open to other questions too. Oh, the pediatric vaccine. So they are, the application is in for the Omicron specific pediatric version. And we're hoping to see that as soon as they get that process completed. Next slide, please. I think it's my resources. Oh no, this. Yeah, these are some really good graphics that I found that are available through the Public Health Collaborative. Some nice kind of messaging that you can use, maybe posters you could hang up or ways you could distribute this information with some nice visuals. Okay, somebody's asking for a contact at Mountain Pacific for IC questions for skilled nursing facilities. So that would probably be Marcy, if you want to put your email in there for us, Marcy. And like I said, this Public Health Collaborative has a lot of good kind of like communications, social media campaign materials. So take a look at that. I've also got it on my next slide with the resources. You can go to the last slide, Mary. So I will point out this, the slides from the advisory, the ACIP slides from September 1st and 2nd, they have all the detailed information on each one of the studies from Moderna, from Pfizer, the general kind of discussion as to the approval and all the kind of clinical data behind. There's like, I think there's like 10 different slide sets. So if you want to dig in a little bit deeper and get more details, I would really highly encourage you to take a look at that link and check that information out. And then just the booster guides that have come out from the drug manufacturers. And as I mentioned, the public health communications toolkit is really helpful as well. Can you point to a reference that mentions the resource as to waiting for receiving a booster post-COVID disease? Okay, 2 months or 6 months. The recommendation that I saw yesterday said that you could do the 2 months if you want, but you could wait that 90 days. As you guys probably recall, originally that was kind of like the time frame that we knew you were well protected after getting COVID. And so that's still kind of a loose recommendation, but you can get it at the 2 months if you want. More questions? Well, thank you. And don't be shy to reach out to any of your Mountain Pacific account managers as things move forward and you have questions. We will put a couple of those that we were unsure about if we get any more information in our Q&A for next week. So I will go ahead and turn it on over to Miranda.
Thanks, Kyla. I did have a follow-up question, actually. So does Moderna and Pfizer both have a bivalent, or does Moderna only have a bivalent and Pfizer will be coming out with one?
No, they both have one. The
Okay.
Pfizer is 12 and older. The Moderna is 18 and older.
Great. Okay.
Yep.
Thanks. Okay, so we're going to switch gears here, and Mountain Pacific now has a new resource that we just want to walk you guys through on managing during the pandemic. And I know we've been classified in the pandemic for quite a while now, but this is just kind of an added help for that. So next slide, Mary. So the first portion of the resource is going to cover micro steps for self-care. It's adapted from the First Responders First, Sustaining Yourself During the Coronavirus Crisis, to create and customize a list of micro steps for self-care, for managing stress, mental well-being, and for connection. So when you look at the resource, you'll see down there the FRF tip sheet final. So you can click on that and look at it, but it talks about micro steps to kind of with self-care. So for self-care, a couple of the micro steps that I wanted to explain were like, keep a water bottle at your station or in the break room, just so you're well hydrated. And next would be give permission to yourself to sit down or to slow down when you eat. You know, a lot of people are guilty of eating on the go because they have so much work or feel that they're being pulled in so many different directions that they don't take the time to necessarily just sit down, decompress, and eat their lunch in a quiet area or outside or whatever, but give yourself permission to do something like that. Another step would be to self-care step would be that each time you walk to your next patient or task, focus on extending your spine. So like standing up straight and taking deep breaths, just be conscious of your movements and your body posture, and use that in between task time to kind of pull yourself back out of, I don't want to say rut, but you know what I mean? Like the day-to-day focusing on your next task, but just be mindful of yourself and your body and your breathing and your muscles and your stress, and just try and get it to release and relax. Another one is when washing your hands, take 20 seconds to think of 3 things that you're grateful for. So I know we all do like the happy birthday song or whatever, to time your hand washing, but you can also use it as ways to think of things that you're thankful for, or positive things that happened that day, or things that made you laugh that day. Just kind of using, because we wash our hands so frequently that you can use that time while you're doing it instead of focusing on your next task or your upset mood or your stress or anything like that, to just try to connect it to something positive. So the next micro step is managing stress. And a couple of the takeaways I got from the tip sheet were take a 1-minute stretch break whenever you can throughout the day. So this kind of leads back to that self-care, but just raising your hands above your head and leaning from side to side, or stretching out your calves to make it easier to walk. But just take those conscious small steps to bring yourself back to you. Or another micro step is on your break, take a few minutes to actually go outside. There's a lot of times where we're stuck inside for so much of the day, and we can look outside and see it's nice, or even when it's not nice, that doesn't mean that you can't step outside, take a couple deep breaths of fresh air, and then go back about your tasks. Another one is when you receive a notification that causes stress, pause and focus on inhaling for 5 seconds and exhaling for 5 seconds, and then repeat the process a couple times, and then go back to the stressor and see if it really causes that much anxiety. And then again, another micro step for managing stress is listen to the calming or recharging song on shift breaks or after the shift ends. So, when you go and you get into your car, I don't know if you listen to books on your way home, or there's a favorite music station, or, maybe you could just have on your iTunes list very calming, relaxing songs. And before you can get into, I'm off work, I really want to celebrate, listen to something that kind of brings the pressure down, brings the breathing down to even, or really calming, and then kind of move about. But give yourself those minutes to decompress after work to kind of lighten the mood so you're not taking work home with you. So some micro steps for the mental well-being is if you are detached or even numb to people and events around you, pause and focus on your breathing. So like if you're sitting in a meeting and your employees are seeming to zone out or whatever, you can encourage them to just take a couple minutes, not minutes actually, because in your meeting you don't want to eat up most of it, but just for them to breathe and refocus, because a lot of times things are so scattered throughout life that you're just, there's a million things, a million times that you need to focus on, but just to stop, center yourself, take a breath, and then refocus on the here and now of what's going on. Another one is if you find yourself judging your emotions or response around the pandemic, remind yourself that they are normal and justified. If you're angry about what's going on, if you're upset, if you're stressed, if you're ambivalent, go ahead and feel those feelings, and they're justifiable. But then again, do your breathing or your stretching or whatever, experience the emotion and then move on past it. There's no right or wrong response to pandemic, especially when it's been going this long, when all the healthcare workers have to deal with it. So another is when you feel overwhelmed, focus on your breathing instead of reaching for your phone. So again, a lot of us are guilty of having our phone attached to our hands 24/7 and maybe looking at reels or TikTok or, funny things on Facebook or whatever. So maybe before you actually reach to that, to decompress, because a lot of times that actually amps you up as opposed to calming you down. Do your, conscious breathing and maybe a little bit of a body stretch, relax your shoulders, relax your back, relax your legs type stuff, and then look at the phone and do that stuff. But you want to make sure you're making conscious effort to calm your system and your body. And then next is when you feel overwhelmed by a problem you face at work, identify the smallest possible step you can take and then address it. So instead of feeling overwhelmed, like, oh, I have to do all this stuff and I'm not going to have enough time during the day, how can I manage all this? Break it into micro steps. What's the first thing that I can do and get that out of the way? What's another thing I can do and get that out of the way? And then instead of looking at the whole, you can actually break it down to a more doable aspect. And then finally, for connection micro steps, if a fellow healthcare or public health worker shares that they are suffering, show your concern by simply listening. I mean, so many times when you vent or you need to express yourself, a lot of people want to fix the problem for you. And then they might be upset that you don't take their advice or you're not listening to what they're saying. And so they're not as apt to listen to you next time. But we have to take a step back and remember that sometimes people are just saying the words to get them out of themselves. They don't necessarily need you to fix the problem for them or judge them on it or offer solutions for them. Sometimes they literally just need to spew the words to get it out of their system, and then everybody can move on. So remember that by simply listening, you're actually being there for your coworkers. You don't actually have to solve the problem. And then at the end of your shift, take 5 minutes to unwind. So but it's kind of a buffering time to release the stress. And this would go back to like in your car, listen to a quiet, or a peaceful song, or, maybe something you would hear in a spa, but you need to make sure that even if it's not in your car or whatever, that you do take that time to decompress, maybe if you're changing for the day and leaving, or whatever your steps are, make sure that you have a time in between work and then your personal life to where you can decompress and then shut the box in the day from work and move about, your life as it continues on. And then also another thing to help with connection is once a day, compliment or thank a coworker for their contribution. Compliments are free and they really do make somebody's day. Like, you have a really nice smile, or, hey, when you helped me with that, I really appreciate that. Or, when you did this without being asked, it really made me feel great. So I appreciate you for that. It's just really easy to take a minute and make sure that you're complimenting one person a day. And that's going to make a vast difference in other people. And you'll find that when you bring somebody's mood up like that, they tend to bring other people's mood up as well. So it's kind of like a pay forward system. Next slide, please. All right, so here we have in the next step in the resource tip sheet is gives you access to this first website, the COVID-19 Pandemic Resource Response. It's at the Center for Study of Traumatic Stress. They actually have access to a free fact sheet, and it's provided by the Center of the Study for Traumatic Stress, and you can share it with your staff or post it in the break areas and staff offices. But this is a library that contains resources for providers, families, and leaders impacted during the peak of the pandemic. And a couple of the resources I have on here, I pulled out just to specify, but there's a tip sheet on recovery and regeneration for healthcare workers following COVID-19 surges, which, we've all seen surges recently in the nursing homes. Support for families of healthcare workers exposed to COVID-19. So I know this is pretty big in the beginning of the pandemic when, doctors and frontline workers would isolate away from their families, even though they might still be there, or maybe hadn't seen their families a couple months because we weren't really sure about what was going on with the virus and how, easily people were affected with it. We didn't have the vaccines at that point in time, but it's still something good to look at. Another one is sustaining the well-being of healthcare personnel during coronavirus and infectious disease outbreaks. So that's just something good to look at. Another one is psychological effects of quarantine, which we all know that went over real well when we first hit the pandemic and everybody was kind of on lockdown. And there was some people that handled it really well and some people that, really didn't deal well with having to be isolated from people. And then the final one that I pulled out was basically, it's about better sleep habits and how you can help fight the stress of what's going on around you if you can focus on your sleeping. So next slide, please. All right, so another portion of the resource is active steps for internal staff engagement and support. So the first one was allow for staff feedback. So, you can provide staff anonymous, written, and or in-person opportunities to speak to you and provide feedback. So that way they feels like there's an open door policy, which is the next one. So you can build bridges to communicate by having an open door policy, or also for the managers to spend time in the staff space. Another one is to survey your staff every week via email or a suggestion box and or write-in survey, and just kind of gauge how people are feeling or what's going on, or what the feelings are with the staff. And then the final is trust your gut. If you think your staff members are struggling, then they probably are. And if you think your staff needs extra support or relief, then they probably do. Next slide, please. All right, and so these are just some learning modules that are in the National Institute for Occupational Safety and Health, so NIOSH, and the link right there for reducing risk associated to long work hours. And this is more, as you can see, some free training and curriculum, including steps to teach and plan for. And then those are the different categories that are underneath of it. So physical and mental impact of sleep deprivation, safe work practices for managers and staff, personnel strategies to promote improved sleep, and then additional action steps and quizzes. And then next slide, please. I'm just kind of going through this real fast here because we're almost at time, or we are at time. And then there is quite a bit more to this graph that I have here but on this slide. But this is just kind of a breakdown of language and intentional leadership during peak of pandemic in word and action. So it kind of shows you what the problem is, the action that leader and support staff can take, and then what that says to the team through the actions of what the leaders of support staff do. And these are just the first 3 on the table, but there's more actually on the resource itself. Next slide, please. So on these resources, the first, managing during the pandemic tip sheet, that's the actual tip sheet itself. And then the rest of the links here are which I had on each of the slides. So you guys feel free to look at it, use it, and go through it as needed. Do we have any questions or anything?
I didn't see any questions, Miranda, but Larissa did mention, Larissa Skinner made a comment just thanking you. It's important to focus on self-care as healthcare workers, as many of us can be overwhelmed by daily tasks. So thank you for putting focus on simple ways to do that, Miranda.
Great. Okay, well, I hope you guys do view the tip sheet, and I hope it's helpful with some of the links that have been compiled. I do want to point out that Comagin originally provided that tip sheet, and then we rebranded it and used it in our what's it called when you work together, her collaboration. So we can't take full credit for it, but we did vet everything that's in that and felt that it was a necessary resource for our facilities as well. So if we don't have any more questions, then I'll go ahead and close the webinar, and I will see you guys, or we will see you guys all back next Wednesday, the 14th. And we look forward to seeing you then. So thank you so much for taking time out of your day to watch the webinar.
Thanks, everyone. Have a great day.
I have a question. Are the slides coming after the meeting?
Yes, the slides will be sent out along with the recording.
Excellent. Thank you so much.
Thank you.